So I've chosen to do my infectious disease presentation on brucellosis or the undulant fever. The disease process for brucellosis, it is a bacterial infection that is spread from animals to people, and it's most commonly due to people eating raw or unpasteurized dairy products. There is multi-system involvement with it, and it does not directly affect one system. So we see it a lot in the reproductive system, liver, heart, and central nervous system. The disease course, it can be treated in several weeks to months. However, the infection can kind of recur if it's not treated correctly. Those at highest risk for developing or contracting brucellosis are hunters, meatpacking employees slash butchers, veterinarians and lab workers, as well as those people in countries who are unable to pasteurize their dairy products, or people who aren't educated in terms of how they should prepare their food, in terms of cooking it, or that also applies to the pasteurization as well. Signs and symptoms of brucellosis, there is acute and chronic. Acute, we will see fever, chills, loss of appetite, sweats, weakness, fatigue, joint, muscle, and back pain, headache. And then with chronic brucellosis, we see fatigue, recurrent fevers, endocarditis can happen if this is something that carries on, arthritis, spondylitis, which is inflammatory and it causes the vertebrae in the back to fuse together. And then we have sacroiliitis, which is inflammation of the sacroiliac joints. For incidence and prevalence rate, there's approximately 500,000 new cases reported annually worldwide, with an estimated 2.4 billion people at risk. But in the United States, there's only 100 to 200 cases reported annually, but the true incidence rate has been estimated at 5 to 12 times greater than that 100 to 200 annual cases. So country comparison, endemic areas for brucellosis include the Mediterranean Basin, the Middle East, Central Asia, China, Indian subcontinent, Saharan Africa, and parts of Central and South America. For the two countries to kind of compare, I chose Portugal out of that Mediterranean Basin region, and then Honduras, which is from Central America. In both, it just seems to be a neglected tropical disease. It's not something that's really tearing through the country at the moment or causing this type of emergency. Both countries have been shown to know about this disease, um, and it's just very neglected in terms of its prevention and treatment, which in the United States, we can give our animals vaccines to prevent against it, and we provide the education to the Americans about pasteurization of milk and then cooking the meat properly. And then we just know in terms of our meat processing and butchering that those people are educated in how they can help prevent it as well. For the treatment of brucellosis, it revolves around antibiotic therapy, and this is a very prolonged cycle of antibiotics with a minimum of 6 to 8 weeks. Um, and this is really just to make sure that it doesn't end up being something that is chronic and that reoccurs throughout your life. And it is focused on a combination therapy of doxycycline and rifampin. Some strategies from the WHO for brucellosis are aimed at prevention and control. And the most effective strategy that they have come up with is elimination of infection in animals. So, like I said, in the United States, they offer the vaccination for it. Vaccination of cattle, goats, sheep is recommended in areas with high prevalence rates, and in areas where eradication through vaccination of animals is not available, food safety measures, especially the pasteurization of milk, are very important. Some organizations that are looking at the eradication of brucellosis are the Food and Agricultural Organization in the United Nations, the World Organization for Animal Health, the Mediterranean Zoonoses Control Program, and the Global Early Warning System for Major Animal Diseases. In terms of SDGs that are met from the United Nations 17 goals, there really wasn't too many that I saw that this was meeting. So, zero hunger I chose. Maybe not a direct one, but if people are unable to prepare their food properly and they're contracting this disease from not being able to prepare it properly, then they will have to start looking at ways that they can either A, substitute those meats, or B, um, find a better way to prepare those meats or that dairy product. And this is not really feasible for every single country, as they may not have those funds or they are very limited in how they can do it. And then the second SDG was the good health and well being. Obviously, looking at eradicating this and educating about its prevention, we are promoting that good health and well being as well. And those are my references.